I think knees in particular, physical therapy is very helpful. The strengthening of the quadriceps muscle, the big thigh muscle, is really good and can be beneficial for knee pains of all different types, and so that's really important. The stronger somebody can be and kind of the more fit and active and prepared for surgery they can be also makes their recovery be a little bit easier. And so physical therapy may not necessarily fix the problem, but if you can get somebody a little bit better conditioning and a little bit stronger before the surgery can certainly help. So we certainly use therapy very often. In general, though, injections are designed to be a pain reliever. So it's a big deal to go through a joint replacement. And so if you can get some extra time and get months or whatever of relief from an injection, I think it's a very reasonable thing. Most people try to exhaust all non-operative measures before they go through a big surgery. And so injections, in particular for the knees, are very, very commonplace. They do tend to work very well. They're not going to make the problem go away, but most people find some relief from them. The hip, it's a little bit less predictable, at least in my experience, and I think our literature would support that. It's not quite as effective for symptom relief, and hip replacements tend to do very, very well. So the need to kind of go through the injection process, if you have very clear-cut symptoms that match your bad arthritis, is not necessarily a requirement from my end. Most people with knee arthritis will have an injection before they go through the surgery, though. The couple things that I warn everybody about, number one is there's always a chance you don't respond very well to the injection. So some people just don't get a lot of relief, and over time you tend to have a little bit of a diminishing effect. So if you've had 3 injections in your knee, the third one's less likely to work as well as the first one did. And so I warn everybody about that. There's a very, very small risk of an infection. We do have to break the skin to get down to the knee or the hip joint, so I always warn people to keep an eye on it. If your pain gets a lot worse, or if you get a big red hot swollen joint afterwards, then we need to know about it. You need to be evaluated. But that risk is extremely, extremely low. That's kind of the big things. If you have really poorly controlled diabetes, the steroid in the injection can make your blood sugar jump a little bit. So if somebody's really poorly controlled, I might hold off on doing a steroid injection. If they're reasonably controlled, I just warn them that if you're checking your blood sugars, you may be a little bit higher for a few days afterwards.